Gemma, this is an important topic because, and I'll talk about this in more details, but dogs lose their lives for this reason when the human animal bond is fractured, and it often does fracture. I don't know if we have veterinarians in the room, technicians in the room, plain old pet owners or pet parents in the room, dog breeders in the room, but whoever you are, first off, I welcome you. And secondly, I empathize with you because I've had a dog with separation anxiety as well. In fact, she's right over there. If I turn my computer, you'd see our either 17 or 18-year-old dog. And sometimes it gets better as they get older, but sometimes not so much. And I'll explain all that, but let me get to it. So what is separation anxiety? Did you see the Super Bowl 2 years ago? This was a commercial that aired, and I hope you can hear the audio.
Excited to see you. Don't get your homework. Back in the office next week, right? Can you believe it? Life is brief, but when it's gone, love goes on, you know. It's a dream. You might like that one. Life is brief, but when it's gone, life goes on, you know.
So a couple things about that video. I'm glad that it was played during the Super Bowl, stressing the importance of dogs and the human animal bond. That part I like. Hopefully a puppy is never delivered in an Amazon package. Separation anxiety means that the dog is separated from its people. Therefore, and I've never known a dog with separation anxiety to take great artwork off the wall. When the people are home, that doesn't define separation anxiety. That could define a bored dog. It could define dog doesn't, as an art critic, I don't really know what's going on there. However, they clearly, when they made this commercial, didn't come to me, didn't come to any of my colleagues about what separation anxiety truly is. Well, we don't want to see that again, but I do want to talk about the fact that maybe, we don't know for sure, we're seeing more of it than ever before, and the pandemic may have something to do with it. Dogs that were adopted from shelters during the pandemic who previously suffered separation anxiety, maybe that's why the dog was relinquished in the first place, or a dog that has been several times relinquished for whatever reason to an animal shelter, those dogs are more likely to have separation distress. But as I think I'll probably say several other times, it is false to believe that automatically any shelter dog is more predisposed to separation anxiety. Also, during the pandemic, some of us adjusted great, right? And others not so much. And it's the same with dogs. When change happens, cats, a different story. But with dogs, when change happens, some dogs can roll with the punches. Many can. I'd argue even many more dogs than people. However, sometimes some dogs just cannot. So, is it separation anxiety in the first place? I do believe very strongly that probably most of you that are, oh, I need to say something. Stop in the middle of my conversation to thank you if you are a veterinary technician or nurse. If you don't know, if you're a pet parent, veterinary technicians and nurses are the backbone of the industry of veterinary medicine. They are the primary communicators in veterinary medicine. I suspect many are here because they are the ones who will communicate for the veterinarian a lot of what I'm about to say. So I just want to take the time to say thank you to veterinary technicians and to nurses. All right. If you're a pet parent, you are not probably diagnosing heart disease in your dog. You're not diagnosing, for example, diabetes in your dog. You may see some things that, oh, this could be, and I'm going to the veterinarian. It should be the same way with separation anxiety, in my opinion. Uh, it is something that a veterinary professional should diagnose, just like those many other conditions. So, is it separation anxiety in the first place? Great, we have these now. We have phones, and you just heard perhaps my phone ping, and I just a TV weather forecaster in Chicago. I'm not saying her name. I don't think she'd mind if I did, but she lost her dog, and it was the first dog she ever lost. And I'm not talking about the dog ran away. I'm talking about the dog passed away. And she was having such a difficult time, which I'm sure you all can understand. And she just got a puppy. So that's what that bing ping was about. Isn't that nice, though? So, is it separation anxiety? Is the dog just bored? It's possible. Is the dog truly under exercise? Now, exercise in of itself is not a solution for separation anxiety. It is a component that can be a part of the solution for sure. And many of our dogs, if not the overwhelming majority, are under exercised. Is this a dog who simply was not ever taught to be home alone? So you adopt a dog from a shelter or rescue, and you're told, oh, this dog is just perfect. But in fact, at a shelter or rescue, perhaps the dog was never alone, and the shelter has no way to know, the rescue has no way to know, and this dog was simply never taught to be home alone. One of the signs of separation anxiety, of course, is defecating and or urinating in the house. But maybe it is, especially for younger dogs or perhaps for very geriatric dogs, an issue, a medical issue or a house training issue. One of the signs of separation anxiety, and I'll go through the signs in a moment, is just barking, 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 and barking. But barking can be what dogs do, right? It can be self-reinforcing. So if the UPS guy goes by, or the delivery Uber Eats guy goes by, or Uber Eats woman goes by, the dog goes woof, 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 woof. That person goes away. The dog is saying, oh, I did my job. Or it was just fun. I went woof, 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 and the person went away. How effective is that? Therefore, teaching the dog to even do it more often. That is not separation distress. Or it could be a component of canine cognitive dysfunction syndrome, which I'll talk a little bit about later. In other words, sort of doggy Alzheimer's, and it can be a component of that. So, what is separation anxiety? I said what it wasn't, but what is it? Sometimes it is from a specific person. More often, it is isolation distress. The dog doesn't want to be alone, and in fact, is panicked, literally panicked. It is nothing short of a panic attack. So, what are some signs of separation anxiety? Most of them are here. And I use this graph because it's so pretty. Matches my shirt today. And this, I'm not going to go through them one by one, but you can read what they are and see what they are. By the way, if you want to take pictures of slides, I'm fine with that. And I believe, and Emma can comment after the talk, I believe this might be archived somewhere, maybe on a YouTube page afterwards. If you'd like my proceedings, they're certainly available. steve@stevedale.tv. At the end of the talk, you'll see my email address. So if you've never seen separation anxiety, I'm going to fast forward a little through this. So the person crates the dog. Crates are not always an answer. In fact, sometimes they're not. So the dog is there. I think you could hear the audio. The dog is whining, crying. I'm going to forward a little bit. Dog is trying to get out. You see the hypersalivation spraying off the dog. You can see that. And the fur literally flying because the dog is panicked, truly panicked. I need to get out of here. Crates can be helpful for some dogs. Many dogs, this is what happens. Even crate trained, quote unquote, crate trained dogs. I'm just want to fast forward a little bit. Dogs can break their teeth. They could crack nails off. I mean, this is For this dog, this is not the answer, clearly, right? And it actually gets worse when left alone. Now the dog is going to go up on the bed. I won't say the dog is calm up on the bed or going out of the room, but calmer anyway. And then the person comes back into the room. So, all right. Which dogs are more prone to separation anxiety? It depends on the study you look at. Different studies identify different breeds, different mixes of breeds. Here's one of many studies. What seems to be in common is the working or herding dogs seem to be like the border collie type dogs, although in this list, you don't even see it. So it really, truly does depend on the study. So is there a genetic basis to it? Probably, maybe, perhaps, we don't know. Could be. A gene in Goldens turned out to predispose them to separation anxiety, and there's another gene that seems to protect them from it. That's brand new data, by the way. 57% of the dogs identified are between the ages of 1 to 5 years. Dogs left for longer periods of time are more likely to have it, but they show those signs earlier or soon after the people leave, generally. So most dogs will show their discontent or panic. Better word, real. That's the real thing. At pretty much immediately or within minutes after the people leave. But it's more of an issue for people that are gone for longer periods of time, according to new research. Almost all, 98%, show at least one sign, show more than one sign of separation anxiety, at least one more, making at least 2 signs of separation anxiety. Whoa, trying to advance my slide. There we go. 2040 to, talking too fast, 20 to 40% of all behavior problems, according to one study, and that study was from pre-pandemic, so that number could even be higher. Adopted dogs are overrepresented. There's no question about that, but it tends to be dogs that have been relinquished multiple times to shelters that are more identified with the problem. So to say to a client, or if you're thinking yourself about adopting, I don't want to do it because the dog's going to have separation anxiety. Maybe there's a slight increase to what the general public, but to think that there's an association there would simply not be true. If a dog was relinquished multiple times previously, then that's another story. That dog is more predisposed. Neutering, those dogs that are neutered, it's more common. Having said that, most dogs these days happily are neutered. So I'm not sure that statistics means a hell of a lot. Interestingly, though, when a dog lives with one person in a household, that dog is more likely to have separation anxiety. Aha, attachment to a one person. And those dogs also tend to be hyper attached. Dogs with separation anxiety almost always have additional anxieties, one or more of them. So there are several studies that show this, and the numbers are slightly different, but generally the same. And the point is that dogs with canine separation anxiety are more likely to have at least one, if not several, of these other anxieties. Canine separation anxiety is often, hold on, how did I get here? Hold on, why is this doing this? Oh no, I apologize. I have no idea. I skipped some slides too. Did I do that? I showed that. Okay, that's where I left off, right? I don't know what happened. I'm sorry. Okay, so why is this so important? It's quality of life for these dogs. If they're having a panic attack every time their people leave the house, that's horrible, right? If not addressed, and I'll talk about how to address that for sure. But if not addressed, that's a horrible thing. But it gets worse. And you understand what I'm about to say. If you've ever had a dog with separation anxiety, you don't want to leave the house yourself. You feel terrible for the dog. And while our phones, which I'll talk about, and I have a little bit to help diagnose it, can be a blessing. It could also be a curse because then you see it happening on your phone and you want to rush home. People don't go out sometimes if they have a dog with separation anxiety, and I understand that. So it impacts everyone. And then what if the landlord or HOA complain? Then the dog may have to be relinquished, or people get so frustrated, or somebody tells them, usually some online site, but it might even be a veterinary professional, or who knows who, a friend of a friend of a friend, that if you have a dog with separation anxiety, nothing can be done. Well, that's not true, but if you're so frustrated because it's been going on and you believe it, then the human animal bond can fracture. And if that happens, the dog is relinquished. So this can be a life and death matter for our dogs. But I have the solution, a solution for canine separation anxiety that you've never seen before. Watch. And there it is, the cat. Well, maybe that really isn't the solution. So I want to go through what never to think about, never to do. Pet parents, you pet parents, if you're watching, this is not your fault. People say, I caused it because I love my dog too much. I share my same bed with the dog. None of these things cause separation anxiety. I kiss her a lot. I love her. I love her. I love her. I hug her all the time. Probably not a good idea to hug your dogs. That's another talk for another time. However, doesn't cause separation anxiety. As I said, it's a myth to think that it is not treatable. I wouldn't be here talking about it if that were the case. Medications are please, not a last resort. The dog is being spiteful. No, that's not happening. That never happens, actually. Dog's doing this on purpose because the dog is mad at me, because my work hours changed, because I have a new boyfriend, a new girlfriend. No, not true. Only rescued or adopted dogs get separation anxiety. I am mentioning that again because there are people who believe it. This dog isn't well trained enough. It's got nothing to do with training. You could have the most brilliant dog in the world. You know, dogs that have done agility and have won competitions. These great athletic dogs can have separation anxiety. They tend to be border collies or Aussies. Maybe. There's more of a tendency among those breeds. Again, as I pointed out, we don't know that for sure. But it's got nothing to do with intelligence. Humans can have panic attacks if they are the most brilliant people on the planet or the dimmest people on the planet. And it's the same with dogs. Has nothing to do with dog training or intelligence. Dogs with separation anxiety must be crated. Crates can be helpful for some dogs, no doubt. But for others, it can actually make matters worse, as we saw in the earlier video. Here's what doesn't work: getting another pet. Now, I have us there, but I concede sometimes it can, especially toward the very end of treatment when your dog is, I'm feeling better about things. But generally, here's what happens. So let's say you have a dog, 6-year-old dog with separation anxiety, and then you get a puppy. Well, what that puppy will learn is to imitate the cues of the other dog. So even if the puppy doesn't have true separation anxiety, isn't feeling the same panic, that dog that does have it, if you follow me, that's howling, for example, or tearing up pillows. Now you have a puppy that may not have separation anxiety, but is going to howl or tear up pillows. Do you follow what I'm saying? And the other dog isn't necessarily going to feel better for the canine company. They either miss an individual or more often miss the people that they live with in their home. We don't know what the dogs are thinking. Some say, well, they're thinking the people are never coming back. I don't know, maybe. We just don't know. Being the pack leader, I don't even know what that means. But another talk for another time about misconceptions. People have really misconceptions about dominance and all of that nonsense, which it often is. Being a pack leader, as one guy on TV once said, is the solution to separation anxiety. It is not. Again, I'm not even sure what that means. Being a good teacher to your dogs is always helpful, but being, quote, dominant over the dogs, that's not going to help, except maybe make the dogs even more anxious. More exercise is always a good thing, but it is not the cure. Taking the dog for a 5-mile run and then leaving the house, now you have a tired dog with separation anxiety. Doesn't really solve the problem. Doing nothing. Well, the dog's going to figure out I'm going to come home because I always do eventually come home. Actually, dogs don't figure that out by and large. And the problem can actually get worse if you do nothing. And of course, punishment. I shouldn't even need this on the slide, but there are people that do still do that. So it's not spite, and it's amazing that the dog seems to be feeling guilty. That's not what's happening.
So guilty. What did you do? What did you do?
So these people are not being violent toward the dog. I don't know for sure what their body language was like, but that's what the dog is reading. The dog is reading their body language and maybe other signals that we don't even understand. But this dog is almost fearful of these people. The dog is not saying, I'm sorry. The dog had torn up pillows and peed. This dog is not saying, I'm sorry I did that. It's unlikely the dog even remembers doing that. And the dog doesn't cognitively think, I did that and I did wrong. Remember, the dog was panicked. So the dog isn't thinking anything like, I'm going to get back at these people for leaving the house, or I'm going to show them who's boss, or anything like that. So this, in a way, is the most important, or one of the most important slides, because if you have one of these, so when I gave, it's a cell phone. So when I gave this similar but very different talk, because I've been talking about separation distress, separation anxiety for years ago, how would we demonstrate that the dog had it? But today, we have cameras that you can buy. I remember when they first came out and I first started talking about this, those cameras were like, $300 or whatever. I don't know exactly. I don't remember, but they were a lot of money for one camera. Now you can get 2 cameras for like $35. Focus the camera on the door you left. Tell your clients to do that, or you do that. If you can get more than one camera, great, because then you could see more of the house and see more of what the dog is doing. I mentioned the phone because the cameras always today connect to the phone. So in real time, you can see what your dog is doing, and that is helpful for behavior modification to help the dog. It's also very helpful to know what's actually going on in the household. So you have eyes in the household, so to speak, even when you're not there. Good lighting is helpful, and all of those common sense things when you have a camera. So be proactive. Even from the time, if the dog is a puppy, many of us don't get dogs when they're puppies, but from the very beginning, when you get your dog, leave exciting things for the dog to do. And this is the same thing, whether it's an 8-week-old dog, 8-month-old dog, or 8-year-old dog, or 18-year-old dog. Well, maybe not 18, but essentially the same answer. Leave the house shortly after you get the dog, not necessarily the minute you come home with the dog, of course. Maybe wait a day, but leave the house. And there is no right or wrong here. Is that how much, a study has shown, bring the dog home, leave the dog home for 27 hours and 57 minutes. There's no study like that. But, certainly be with the dog for about a day, but it's a good thing to leave. Many people don't. They're with their dog 24/7 for the first days, if not weeks, sometimes, that they get their dog. So be sure to leave, but leave things that are great for the dog to do in your absence. Set up the camera so you can see what's happening. If the dog is food motivated and the dog is not going after food in any way, that alone can tell you there's some distress going on. See what goes on. You could leave treats inside a Kong toy. One idea that I like, and I like it because it's my idea, is to leave something up on a countertop. Unless you have a Great Dane, the dog can not get it up there, can see it and smell it because you've shown the dog. Do this about 7, 8, 9, 10 minutes before you leave. The dog is focused right there on that great treat, not a good treat, a great treat that's on the countertop. Maybe stuffed on the side, a couple of Kong toys or whatever you use is fine. And then as you leave the house, put it down. Don't sneak out of the house. Then leave the house, make sure the dog knows you're going, and see what the dog does. The dog may then associate that great treat with you leaving the house. Now, sometimes it's rare, but it can backfire for a dog that's already have separation anxiety, eh, or people have said then the dog wants you to leave because the dog is getting treats, and I've never heard of that happening. But have a camera to watch it all, or have your clients have one. They are inexpensive by my way of thinking. What is that guy thinking? So if you ask that guy, the guy who's half out the window, to fill out my income tax or your income taxes at this very moment, can't do it. Clearly, it is impossible to learn or to concentrate on anything if you're panicked. And the same is true for dogs. So we need to deal with their panic before we do the behavior modification or simultaneously. But to just do the behavior modification or to try to teach the dog, okay, it's not so bad to be home alone. Well, you don't do anything about the panic is not likely to be all that effective. And now we have great ways to do that. So one, and I'm not going to go into the specific pharmaceuticals, but they are pharmaceuticals. And this is important because there are drugs that may be a lifesaver for the dog, quite literally. So if indeed your HOA has said, you know what, you've got, or the landlord has said you have X number of hours and you got to go. That happens, by the way. You have 2 days and then you're going. If that dog doesn't shut up, then you need something, right? And there is something. There are options available. I'm not a veterinarian. I'm a certified animal behavior consultant. I know what I'm talking about in my lane, but I'm not going out of my lane. So talk to your veterinarian about the right drugs if that is the choice for you, or for you veterinarians, you know what those right choices are. But there's another heavy hitter out there now. So I'd say there are two of them. One, pharmaceuticals, and the other is about what I'm about to talk about here. It's called the Calmer Canine, and it uses physics rather than chemistry. So electromagnetic therapy rather than a pharmaceutical or a drug. But they both have a similar effect on the body, and they both do similar, anyway, sorts of things. So it's a device that goes over the dog's head. It emits targeted pulsed electromagnetic therapy. It took me some practice to say that fast. So what it does, nitrous oxide inhibits pro-inflammatory cytokines and increases anti-inflammatory cytokines. And we don't want that. What we want to do is to produce endorphins that are positive or happy, if you will, for lack of a better way of saying, that help support comfort, like serotonin and dopamine. And we want to see a reduction in actually swelling of the brain. So anxious dogs and panicked dogs for sure, and I believe the same is true for people, but that is not my expertise. Actually, their brain swells a little bit. And what this does is it works, it's not at all an anti-inflammatory, but it works similarly in that it reduces swelling. It really does. So all of this combined, these signals, these targeted pulsed electromagnetic therapy signals, do something very, very similar to what the pharmaceuticals do. And in today's day and age, there are many, many people who say, I'm not going to use a drug. I'm just not going to do it. Or this, by the way, can be an adjunct to drugs, all of which I'll talk more about in a minute. So this is what the device looks like. It's 2 15-minute sessions a day. There's a vest, comes in different sizes for different size dogs, that can be worn like this dog is wearing, or if it's comfortable for you, you don't have to put on the vest on the dog. You could just simply hold it over the dog's head as such. Treatments can be done when the owner is home, obviously. The dog is not going to do it himself. But this is a dog with separation anxiety who wants you home. The treatment course is 4 to 6 weeks. Now, for some dogs, according to studies, I'm going to show you a couple of those studies, but for some dogs, it works far more quickly, or it begins to work far more quickly, where the results are seen by the pet parents. Others can take 3, 4, 5 weeks. It depends on the individual dog. And in some cases, for it to really work the best, all right, 4 to 6 weeks, begins working really well at 4 weeks, but you really need 7 weeks or 8 weeks of it for really it to do its job. So here are the results of at least one study: statistically significant reduction in canine separation anxiety in a video analysis of dogs. I'll show you 2 of those videos, actually. I have many. All dogs showed improvement ranging from a complete resolution to a 50% improvement, but all noticeable. The improvement affects 2/3 of the dogs, and there were no side effects for 100% of the dogs. So in other words, 0 side effects for this. I mean, so that's something that is different than a pharmaceutical, right? And many of these dogs may be, for whatever reason, also unable to take a pharmaceutical due to a comorbidity or an other medical issue. Here's another study from 2021, the end of the year, a placebo-controlled study that showed the results, and I'm not going to read this thing word per word, that showed that I'm going to show you the results, but that demonstrate results. And there's other studies too that are available in my proceedings, or if you want to Google, you'll find them. So this is from the same study. Dogs treated with Calmer Canine showed a significant reduction in signs of separation anxiety. By the 6th week of treatment, actively treated dogs had a much higher success rate and improvement for positive behaviors. And by the way, they looked at canine cognitive dysfunction syndrome. But when you reduce anxiety, and these dogs, as I said earlier, all have other anxieties, this helps those dogs in other ways too. Calmer Canine was shown to be safe and well tolerated. As I said, no side effects whatsoever. So seeing is better than believing, right? So you're about to see a beagle. Note the Kong toys stuffed with treats all over the room. I'm going to fast forward. Part of this, you don't have the audio. I don't have the audio for this, but you could see the beagle, Elliot, 3.5-year-old beagle's howling. One can argue that's what beagles do, but not to this extent, right? But Elliot's going to do more than just howl. First of all, it's what he's not doing, right? And that's what he's doing, is tearing up the bed, as you see. And what he's not doing, it's a beagle, and he's not going for the food. He knows the food is there. I don't know if the owner showed him, but he's a beagle. He knows the food is there. And this dog is making a lot of noise, right? So I'm not going to show more of the tearing up the bed, and it kind of breaks my heart to see all this. So that's before. And, oh, why did it stop? Hold on. There we go. Come on. Wow. There we go. And we're going to see after in a moment. So this is 1 month, not 6 weeks. 1 month later, the beagle is now interested in treats. There aren't as many Kong toys with treats, but he found the 1 or 2 that have it. Different dog, right? Looks much calmer. And there's data to demonstrate that we're about to see for this individual dog. Dog is not tearing up the bed. The dog is not howling. And here's a before and after. The howling is still there a month later, but it's a beagle. But, 15% of the time rather than 71% of the time. All right, now, next dog. I've got a million of these. So this dog is Cooper. One sign of separation anxiety is dogs that are hypervigilant, constantly looking out the window, constantly looking at the door that the people left at, and then demonstrating in signaling or canine body language, anxiety. And that's what this dog is doing. Clearly, Cooper is barking. This is a month later. Here, Cooper looks like a little doll. And even when dogs lay down, there are ways in which they lay down, right? There really are. So you could tell by the way a dog lays down whether the dog is comfortable or the dog is nervous, anxious, upset, panicked. And this dog is comfortable. Clearly, you don't even have to be an expert, a veterinary professional to realize this dog looks like, I'm just hanging out. And here's some before and after. Far less vigilant 1 month after. The whining literally disappeared and the barking literally disappeared. So to me, and there's video after video that demonstrates similar types of results. So some practical issues here. This can be great first line treatment. Lower doses of some of the drugs may be required. So you can still, for some people, still use the drug, but now lower doses. So, for example, dogs on trazodone tend to be, not all dogs, but most tend to be like, what's the right word? Out of it? 3 words. For a while afterwards, and some people don't like to see that. It depends on the dog, but you get the gist of what I'm saying. A lower dose is always better, right? A first choice in treatment very often for multimodal therapy for severe cases. It could be a jump start to improve all cases. And older dogs, as I said, with less tolerance for dogs, older dogs with less tolerance for drugs. And the Calmer Canine has 0 side effects as far as anyone knows. Now I want to talk about behavior modification because this is important. So once the Calmer Canine is used and begins to have some effect and or a pharmaceutical, then we want to do some of these things. Calm returns and eradicating the cues. I want to talk about that. So what we do sometimes when we come home, these dogs are hyper excited. All dogs are happy to see us, but these dogs with separation anxiety seem to be even more excited to see us way over the top. And what we respond in kind, typically, because that's being human. So the dog goes crazy, we go crazy. Don't do that. So instead, there are people out there that say totally ignore the dog. No, don't do that either. That's mean almost. However, this is what I say. When you come home, wait until the dog relaxes enough where you can say hello to the dog and the dog isn't jumping, screaming, anything like that. And the dog is much calmer. Maybe even you can get the dog to sit. At that point, pet the dog, and the dog's probably going to go crazy again. So wait it out until the dog is calm, and then pet the dog again. That in itself is not a cure for separation anxiety. But there are 2 factors here. It can be part of the plan, for sure. And also, what's wrong with a calmer dog not jumping on people that is happy to see people? So teaching the dog not to jump in some way, shape, or form is always a good thing anyway. Encourage independence in the house. Oh, one more, departure cues. I mentioned that. Then I'll get back to independence in the house. I promise. Departure cues. So try to do this. And there is some data to show this. What I'm about to say helps a whole lot of dogs. Leave the house, put on coat and gloves if you're in the winter in Chicago, but whatever you do, put on your shoes, and leave the house. But don't go anywhere. I'm getting, didn't that just happen where it was light and dark? Leave the house. And I'm talking about leaving the house for 10 seconds, then come back, 20 seconds, then come back. And your dog eventually is going to think, this person's crazy. Then a minute, then 2 minutes, then 5 minutes, then 2 minutes, then 8 minutes, and mix it up. There is no exact formula. But once you get to about 40 minutes to 50 minutes, probably you're good. If the dog, and you have a camera set up, you can see what the dog is doing, and you know what the dog's response is when you come home. So if the dog's going crazy or the camera demonstrates your dog is anxious, you went too far for too long. You do that maybe over a 3-day weekend, and then here's the problem. The next day, you got to go to work, and then you kind of backslide. So for that week, if it's possible, to have someone stay with the dog. And then when you come home from work, or your client does, that your client continues the same protocol. Does that make any sense? This can actually be helpful. Will it help? The thing about separation anxiety, what works for one dog 100% of the time is not going to work for another dog 100% of the time. It's different with every individual dog. So if we're talking about treatment for, oh, I don't know. I guess I can't, let me think of something where this works. Treatment for certain things, I don't know, because treatments can be different for different dogs too. So I'm going down the wrong road here. My point is every dog is different, and there is no absolute 100% fix that'll work for every dog every time. That's what I'm trying to say. Now, simultaneously, try to encourage independence. So take the dog, in the same room you're in, but now further away from you on a dog blanket or a dog bed, and the dog is working at getting food out of a toy or some such thing to keep the dog occupied. But then move that bed or blanket further down a hallway, and over time around the corner into another room. So you're teaching the dog to go to college. You're teaching the dog to be independent of you. You're teaching the dog to be happy, content, if not happy, at least content, in a place where you're not at. So having pet parents do these things, as well as increase exercise, that is a part of the solution. Having appropriate exercise, and also enriching the environment the dog lives in. And my God, I'm running out of time here, but that is a whole other talk about enrichment. But most dogs live in an unenriched environment. So this is just kind of a summary of what I just said, actually. So the problem is I just gave a whole lot of instructions. I gave them in a complicated way. And the fact is that compliance can be tough if we give pet parents, and for you pet parents, please don't be offended. Doctors say the same thing, I believe. If the solution is more than a couple of instructions, people get lost. So try to keep it as concise as you possibly can. So I'm going to go through quickly some other things that can be helpful. These are adjuncts. These are not in of themselves solutions, but they are helpful. So Calming Care by Purina, Purina Pro Plan, is a veterinary supplement. We know there is a brain, gut communication that goes back and forth. I mean, it's true for dogs just as us. I don't know that dogs take a driver's license exam, but if they did, they might get nervous before that exam. And for you might get nervous too. And if you do, it goes to your gut. Yeah, right? So it is the same for dogs. So this can be helpful for many dogs. There are so many nutraceuticals out there. I'm offering two because these two have science to back them up. As I said, there are many. So Zilkine contains hydrolyzed milk protein. It is for situational stress primarily, and leaving the house with the dog home alone is situational stress. So taking some of that and sprinkling it on the dog's food, or not both of these, that's overkill. Well, it wouldn't hurt the dog, I don't believe. In fact, I know it wouldn't, but it's overkill. Angstitane is another option. That's L-theanine. That's an amino acid that is found in green tea and demonstrates same thing, that dogs after taking this are more likely to be relaxed. One of these two might be a good idea, even if you're doing these other things, the targeted pulsed electromagnetic therapy and or a pharmaceutical. So what sticks for one dog doesn't for another. Some dogs, Thunder Shirt really helps. Other dogs, not so much. Versions of the Thunder Shirt kind of are the Anxiety Wrap and Storm Defender. All of these have a swaddling effect, sort of, for the dog. Thunder Ease is a Thunder Shirt with Adaptil, the pheromone in it. And there's a new pheromone product coming out this year, by the way, that I'm so excited about. So Dr. Patrick Page is the guy who really came up with the idea. He didn't invent pheromones, but he came up with the idea of using these natural chemicals with dogs, which dogs and cats and most mammals emit, and other animals too, by the way, and using them in a way that supports not only companion animals, he's done the same for zoo animals, and any animal in quote captivity. He's brilliant, brilliant. And he said, you know, Adaptil and Feel Away, the cat version, came out so many years ago. So a product called Signs, look for that this summer, because that is his update of these products that he said, okay, now we know more than we did all those decades ago, actually, when these products first came out. Now we can do better. So look for that. That will be better than what's out there now, I believe. Music therapy can help for dogs. We're talking classical music and reggae. Gives a whole new meaning to Marley and me. A ceiling fan can add white noise. This is not what I mean. No, no, that's not helpful. And turning on a radio or TV can actually be helpful. Talk radio station, preferably that I'm on, or television. No, enough of that. Or CBD. People ask me about that all the time. And the answer is, I don't the hell know, you know, because studies have been done about CBD for neurological issues, for osteoarthritis, but not for behavior issues. Anecdotally, many people have said it works. The problem is all CBD products are totally not the same. So talk to your veterinarian about a trusted CBD product. If it works for you, great, but I can't assure that. And some of those products available, especially from China, have bad things in them. So there are trusted products that veterinarians do know. Don't these guys look like little angels? I think so. I was given 50 minutes for the talk. I'm at 48 minutes now, I believe. So right on time. This is where you can find me in social media, except my Facebook community page listed up here. If you could see my mouse, it was hacked. Hope to get it back, and about 100,000 people that are there. But these other places you can find me for sure.